be asking you questions specifically about what's on the screen I'm sharing. So, and let's do this. Bear with me. Let's do that. Boom. Share. Okay. Let's see if this pops up. Hold on. Here we go. All right. Okay. All right. Mr. Singletary.
I knew it. Just beat on the black man.
That's
always.
Right.
Just beat the black man.
Yes, sir. Mr. Singletary, what is this bone right here?
That's your sacrum.
Very good. If this is my sacrum, what's this bone right here?
That's your lumbar section.
It is, but what's this bone?
The actual bone. Because the thoracic lumbar is further up.
Don't quite understand what you're saying there, but that's okay.
No, I was saying the thoracic lumbar is further up. I said, no, that's not it.
Well, I don't know what thoracic lumbar is. There's a thoracic section and a lumbar section.
Thoracic lumbar is what I was saying. Sorry.
Yeah, I don't know what thoracic lumbar is, but I'll just keep repeating myself. Sir, I want to know, since you're a senior in massage school, what bone sits on top of the sacrum?
Shit.
It's not the humerus and it's not the femur.
Oh,
What?
The pelvic bone?
Mr. Singletary.
You said sits on top of... wait a minute.
I'm pointing to it right now. What is this bone? It is a vertebrae. It is in the lumbar region. Which lumbar vertebrae is this, sir? It's lumbar 1 through 64. Take your pick.
64.
There is not even 64 vertebrae in your spine, sir. There are 20.
Sorry, I'm talking over top of you too.
No, it's okay. I'm talking over the top of you too. I was being kind of a pain in the gluteus maximus. But, sir,
okay.
if this is your lumbar region, how many lumbar vertebrae do you have?
So 12.
That's how many thoracic vertebrae you have. How many lumbar vertebrae do you have?
Oh, wait a minute. Oh, 7, 5, 12. Sorry. 7 up here. Hold on. I'm rusty, okay?
I know. That's actually why I'm calling on people, sir.
5.
Okay. Good.
I had to think for a second.
Good. So which lumbar vertebrae is this?
Oh, okay. That's the... That's not the cervical, because that's 7 minutes up. So that's the L. Is that the L5?
Yes. What does L5 stand for?
Lumbar?
Yep. Lumbar number 5. So which vertebrae is this, sir?
Did you just move your little cursor up 1?
Yep. Which lumbar?
L4.
Yes. What's this one?
And then 3, and then 2, and then 1.
Good. So what's this?
That's your, that's the C, that's the top. Circles up at the top. And this is the center, then this is the L's. C's.
It's got ribs coming out of the side of it. Anything with a rib associated is in what region?
Shit.
I don't think that's a vertebrae, sir. Yeah. Anything coming with a rib coming out of the side of it, sir, is in your thoracic region. This is a thoracic vertebrae. Which number is this?
I can't believe I can't remember this.
How many ribs do you have?
12. Well, yes.
How many thoracic vertebrae do you have?
12.
Good. Which thoracic vertebrae is this?
Are you going to say T12? Well, Well, you're at number T12.
Good. Which one is this?
Did you go up one?
Yes.
T11.
Good.
And then 10, 9, 8, 7, blah, 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 blah.
8, 7, 6, 5, 4, 3, 2. T1 right here. What vertebrae is this above T1?
That's your C7.
Very good. What is this up here on top?
That's a C. Well, I know it's a C1 there, but there's something else.
No, it's just C1, sir.
Okay. I was thinking above. I thought the little character was above that. I'm sorry.
Don't overthink it. No, don't be sorry. Don't overthink it. All right, sir. Good. So really quickly, just to make sure we've got vertebrae down, what is this bone down here?
Where's your cursor at?
Oh, sorry, I moved my. What's this bone down here?
Oh, it's your sacrum.
And what's this bone up right above the sacrum?
It's your L5. Sorry.
Good. 4, 3, 2. This is L1 here. What's the bone right above L1? Oh, sorry. What's the bone right above L? Well, let's try it again.
It's T12.
T12. Good. And if this is T1 way up here, what's the bone right above T1?
And that's your C5. I mean, sorry, C7. Sorry.
Good. And what is the bone on the top of my spine?
And that's your C1.
Thank you. What's another name for C1, sir?
That's what I was trying to think of. I couldn't remember.
It's holding the world up. It's a Greek god that's holding the world up, essentially, on his shoulders, like a giant globe. We've tortured you enough, sir. I'm going to go to somebody else. Thank you. But you're going to get an answer to that question. Don't worry. It's coming. It's coming. Miss Hendrickson, what is C1 also called?
Atlas?
Yes. What is C2 called?
Axis?
Axis. C1 is Atlas. It holds the world on its shoulders. C2 is where you rotate your head back and forth as you shake it in dismay. And that is your axis. Yes, very good. Thank you, thank you, thank you. Okay. Let's do a little review and see if we were listening to Mr. Singletary. Miss Suriel.
Yes, Mr. Topscat.
Miss Suriel, what bone is this?
That is the, oh my God, he just said it and I always forgot the name. Hold on. That is the, sacrum.
Yes! So what bone is right above the sacrum?
That one is the fifth, C1, C5, I'm sorry.
C5. Well, the problem is C means cervical, which is neck. So now my neck's down by my bottom.
Oh, it's T5?
That means thoracic, so now my ribs are down by my bottom.
Okay, so it's cervical, thoracic, and lumbar.
Lumbar! Yeah. You know in your car how you have... Why can't I not get my cursor over there? You know in your car how you have like that little lumbar support in the back of the seat? It's for your low back. That's how I remember that. So this is L5. So
L5.
if this is L1, what's the bone on top of L1?
T12.
Yes! And if this is T1 up here, what's the bone on top of T1?
T7.
Yes! And what's the bone all the way at the top of your spine?
The axis or the atlas?
Atlas. C1 Atlas. That was good though. Thank you, ma'am. Thank you, thank you. That's perfect. Miss Marez, welcome to class.
Glad to be back.
Oh, it's good to have you back, ma'am. Ma'am, what is this bone here?
I think it's the sacrum.
It is the sacrum, ma'am. Good. What is the bone right above the sacrum?
That's the lumbar, and that would be lumbar number 5.
Yes! So if this is lumbar 1, what's the bone right above lumbar 1?
That's a thoracic, so that would be 12.
Yes! I like the way you're reasoning it too. If this is thoracic 1 here, T1, what's the bone right above T1?
So the neck is called the cervical. That would be the cervical number 7.
Yes, ma'am. And what is the top vertebrae on your spine called?
That would be the cervical C1.
Yes, also known as Atlas. Well done, ma'am. Welcome back to class. You haven't missed a step. Thank you, thank you, thank you. Nicely done. Miss Green.
You're.
Miss Green, what is this joint right here called? It's your shoulder joint, essentially, but what's it called?
Probably, is that your, like where your pelvis is?
Yeah.
Or is that your shoulder?
Yeah.
His shoulder, okay. Is it your ball and sock?
It is a ball and socket, ma'am. You are right. But so is your hip. So how do I tell this joint from your hip? What do we call this joint? What are the bones that come together, kind of? This joint is actually named by this bone and this this fossa, this indentation right here.
Is it the glenohumeral joint?
Yes, because this is the glenoid fossa of your scapula and this is your humerus, glenohumeral joint, and it's a ball and socket. Well done. Thank you, ma'am.
Thank you.
Miss Young.
Hello.
Hi, Miss Young. Hey, Miss Young, what's this joint called? It's a ball and socket, too.
The coxal joint?
Yes, that's very valid. Coxal joint, some people call it the acetabular femoral joint, but that's not me correcting her. She's right. Coxal joint, hip joint, acetabular femoral joint, all that's excellent. Thank you, thank you, thank you.
Thank you.
Mr. Craven. What is this joint here called? It's your knee joint, but what do we call it? Just speak up a little louder, sir. Well, your patella's on top of it, but what two bones really come together to make up your knee joint? I admit your patella is a very key part of it. But what two big... Tibial femoral joint. Thank you very much, sir. Well done. Tibial femoral joint. Cool. Hey, Mr. Singletary. Mr. Singletary? Going once?
Was in the bathroom.
Oh, okay. Mr. Singletary, I want to make sure that you're soaking up all this wisdom. Really quickly, Mr. Singletary, what bone is this?
Sacrum.
Yep, what's the bone above it?
Ooh, Jesus Christ.
No, that's not a bone.
Teeth. No, I'm trying to straighten myself out. You're 7. T7.
No, sir. What is the bone above the sacrum? It is not T7. That sounds for thoracic. Your ribs are not above your butt.
Oh, God, help me, Jesus.
It's going to be a rough 2
Sorry,
months.
you're L7. Sorry.
There is no L7, sir, in existence. Well, that's not true, actually. Some very, very rare instances. Some people have an L6, maybe an L7, but...
7, 5. Oh, what did I say?
You said a lot of things, sir. What bone is above the sacrum? What?
You know I don't mind. You know I don't mind. It's an L5.
Thank you. No, you're great. Thank you, sir. Thank you for being a good sport. What is the bone above L1?
That is your T12.
Yes. What's the bone above T12? T1. T1.
That is, above it is your C7.
Good. What is the top bone in your spine called?
Your C1 or your Atlas.
Yes. What is the C2 called?
Axis.
Yes, that was perfect, sir. No, axis. That was perfect. Sir, what joint is this right here?
That's your glenohumeral joint.
Yes, sir. What is this joint here?
Okay. I was in the bathroom.
Hopefully this joint worked for you, because you wouldn't have been able to sit down on the toilet.
I had to run back to the screen.
It's a couple names. You want to skip that one?
Yeah.
What's this joint down here?
With the pubic and the ramus.
What's this joint? What's your knee joint called, sir?
Well, I know that's your patella area.
Yep, it is your patella area.
But that's not what you're looking for.
I'm looking for what two bones come together to make your knee.
Tibular from.
Yeah.
Tibular from.
Keep going.
Tibulofemoral joint.
Yes, tibiofemoral joint. Well done, sir. And this is called the coxal joint. Your hip is either called your coxal joint or your acetabular femoral joint because your femur fits into the acetabulum. Just like your shoulder joint is called your glenohumeral joint, this is called your acetabular femoral joint. They're both kind of named by the fossas they fit in. Very well done, sir. Hey, sir, I want to make a promise to you, too.
What's that?
I just want you to know, because I love you so much, that I'll be calling on you constantly to make sure that you're picking all this stuff up, because I care, okay?
Oh, no. I don't.
Good.
That's fine. It's
Awesome.
all in the learning process.
Good. Cool,
Think
cool,
you're
cool.
always he's just picking on the black man. No, I don't think that's
Mr. Overman.
Yes, sir.
Mr. Overman, what bone is this right here?
That is your humerus.
Yeah, what's this bone right here that's going to your thumb?
That's the radial.
What's this bone going... You're correct, by the way. Thank you, sir. What's this bone going to your pinky?
That is... Oh, crap. I think I'm drawing a blank on that one.
Definitely not crap.
Not crap? Okay.
Yeah.
Radial and... Not...
I need an alternate answer than radius and
Ulna.
crap. Ulna. Very good. What's this bone right here?
That is the femur.
Yeah. What's this little funny sesamoid bone on top right here called?
The patella.
Yes. What is this thick medial bone here called?
That is the... give me a second. Tibia.
Yes. What's this thin lateral bone called?
Fibula.
Nicely done, sir. Thank you very much. Thank you, thank you. Cool. Miss Everson.
Yes, sir.
Miss Everson, what's this bone right here?
Scapula,
Yeah. Hey, what's this bone here?
the clavicle,
Yeah. What is this process here? This is actually part of the scapula. Do you know what this process is called?
the chromium process,
Yes. So what's this joint right up here called? I'm not talking about the ball and socket. I'm talking about right here.
chromium fossa.
Yeah, the acromioclavicular joint.
Yeah.
Yeah. Well done. Cool, cool, cool. What is your elbow joint called?
Ooh. Humerus and radius. So humeral.
Put it with your ulna, because your ulna is what really makes your elbow.
Okay. Humeral ulnar joint.
Yes. Thank you very much, ma'am. That's good. Humeral ulnar joint. Awesome, awesome, awesome. Where were we? Mr. Jones.
Yes, sir.
Mr. Jones, what bone is this right here, your heel bone?
Oh, man.
Yeah.
Your calluses? Calcaneus?
Pretty good. Calcaneus. Yes, sir. Did you need me, sir?
Trying to see if
Miss who? Hold on one second, guys.
Catherine.
What?
Catherine?
Leota?
Yeah.
She's over in the main building. She's over at the Southwest Skill Center building.
Can you get one of your meds?
Thank you.
Yeah, grab one. Go. All right, everybody. Let's see. Mr. Bose. Mr. Bose. Mr. Bose. Thank you, Mr. Bose. Mr. Bose, let's just make sure you got all this. Mr. Bose, what is this bone right here?
Sacrum.
Yeah, what's the bone right above it?
L5.
Yep, what's the bone on the top of your spine?
Your atlas or C1.
Thank you. What's the bone right underneath C1?
C2 or your axis.
Nicely done, ma'am. What is your knee joint called?
Why does popliteus always come to my mind? But
Because it's the
not
popliteal region. I'm always trying to point to answers too, so I'm pointing to this bone on the medial side of the leg down here.
Which is your fibula?
No, it's not. Your fibula is on the lateral side of your leg. It's the smaller bone.
Oh. So your tibia.
Yep. And now I'm pointing to this bone up here.
Your tibial humeral.
Humerus is up here in your arm. You're making a very weird human being.
That's your femur.
Yeah, there you go. Talk to me.
And I'm trying to mash them together.
You pretty much did.
Tibial-femoral joint.
Yes! Tibial femoral joint. Thank you. What is your hip joint called?
Is it the acetabula?
Acetabular is the hole here. What's this bone here called?
It's your femur. So femoral.
Flip it. Acetabular what?
Oh, acetabula femoral joint.
Good. What's your shoulder joint here called? The ball and socket up here.
The glenohumeral joint.
Yep, it's also named by its socket in the bone. This is named by the socket in the bone. Very cool. What's your elbow called?
Okay, that I was actually confused on because I know when Miss Eve said it, but I thought it was the electrodon process. Not the thing she said.
Ah,
Are there two
good
names
point.
for it?
The electrodon process is the bump on the end of my ulna. It is my elbow, but it's not my elbow joint. My elbow joint is where my this upper bone comes together with my ulna.
So that's your humeral ulnar joint.
Yeah. Nicely done. Thank you, ma'am.
Okay.
Thank you. Okay. Might be time for a break for you guys. Let's take a... All right, everybody, and we're back. Let's do a little more quick review and make sure we're all on the same page. Miss Stevens, I know this body is diagonal, but what bone is this? Miss Stevens, going once, going twice. Where are you? Mr. Snell.
Hello.
Mr. Snell, what bone is this, sir?
Can you do it again? Sorry.
Yeah, sorry.
Tibia?
Yeah. What's this bone out here on the lateral side?
The fibula? Yeah, the fibula.
Yep. What's this little round sesamoid bone here?
Patella.
Yep. What's this bone here?
That would be your femur.
Yes. Now, sir, this gets trickier because this is really three bones, but what is this top part of your hip called?
The ischium? Ilium?
Ilium is the top one, yeah. Ischium is in your tuschium, down here where you sit. And then what's this bone kind of in front here called?
Oh, like the pubic?
Yes, the pubis. Yeah.
Pubis, sorry.
Yep. Ilium, ischium, and pubis. Good. Good job. Thank you, sir.
Thank you.
Miss Stevens? Going once, going twice? Oh,
I'm
good. Good, Miss Stevens. Miss Stevens, what bone is this?
Your tibia.
Yeah, what's this bone on the outside called?
Your fib. Is there an element?
Fibula.
Fibula?
Fibula.
Okay, yeah.
What's this little sesamoid bone here called?
Your patella.
Yeah. What's this largest bone in your body called?
Your femur.
Yep. What is this part of your hip called? Because your hips are actually made out of three bones. So what's this big part up here?
Is it your ischium?
Nope. You sit on your ischium. It's down here.
Ooh.
But I can see why you made that mistake because it starts with an I.
Ilium.
Ilium is correct.
Yeah.
And what's this bone here in front? It's part of your hip. It's not your ilium, and it's not your ischium.
Iliac.
No, this is iliac crest up here. It's in your pubic region.
I'm not sure. It's probably really easy, but I'm not.
It's your pubis. Ilium, ischium, and pubis. Yeah. Cool. All right, thank you, ma'am. Miss Savarino.
Yes, hello.
Hello, Miss Savarino. Hey, Miss Savarino. Ooh, here's some toughies for you. What's this joint here called?
That is your acetabular joint, no?
Acetabular what?
Femoral?
Yes, because it's where the acetabulum and femoral come together. Nicely done. Acetabular femoral joint. Hey, what's the joint between the two pubic bones called?
Is that you're talking about the joint?
Yeah,
the
this is actually a joint, believe it or not, in front of everybody here, where it's a cartilaginous joint. It doesn't move a lot.
It's not the coccyx then.
No. It's in front where the two
Is the front one?
Yeah, where the two pubic bones come together in a sort of symphony of singing. La.
Damn, I feel like that's a clue.
Yeah, the symphony part probably is. Let's just call it the pubic symphysis for now.
Pubic symphysis.
Symphysis, as in symphony.
Symphysis. All right.
Good. Hey, what's this joint back here called between the sacrum and the hips?
Is that the ilium?
Well, this is the ilium. So what's this joint called? These are harder. There's no doubt about it.
Yeah, Mr. Dad's got like the other ones are easier.
I know. I don't like you very much.
The other ones, and then you're like, oh, you know what? We're gonna
I'm like, what is the capital of Istanbul, and what's their major export product? Yeah.
Hey, man. They've got you. Cool.
So what do we call the joint where your sacrum and your ilium come together?
Iliosacral?
Or maybe sacroiliac joint?
Oh, duh. Sacroiliac joint.
The SI joint? Yeah, cool. All right, that's enough torture. I'll move on. Thank you, ma'am.
Yeah, I know. I was saying, Miss Rader, I crack it all the time. Yeah.
Yeah, that's why I thought. Yeah, that's one that you definitely
the
do.
SI joints. So I would just call them SI joints. All right, thank you, Mr. Pat. Sorry.
Thank you. No, you're fine, buddy. Mr. Richards.
Yes, sir.
Mr. Richards, what is this bone here?
Sacrum?
Yeah. And what do you call the joint between the sacrum and the hips?
Sacroiliac joint?
Yes. What do you call the joint in front here between the two halves of the hips?
Pubic symphysis?
Yes, sir. I haven't asked this yet, but it's, well, anyway, never mind. What do you call the joint between the sacrum and this vertebra right on top of it?
So it's got to be, that's the L5.
Yep.
So sacrolumbar joint.
People just call it actually L5S1. I know you only have one S, but they call it L5S1 because your sacrum used to be multiple vertebrae that were fused together. So
you wouldn't put them two names together,
you'd call it L5S1.
Okay.
And the reason I'm saying this is because most people get herniated discs in L5S1 or L4L5.
Right.
Because all the weight of your upper body is down on this stuff here. So you tend to have more problems down here. That's kind of why I brought it up. Hey, sir, what's the name for your knee joints?
It's tibiofemoral.
Yes! What's the name? I haven't asked this one yet, and it is hard. What is the name of your ankle joint?
Talocrural.
Whoa! Everybody, he's right. It is your talo because your talus is what your tibia sits on, and that is the crural region. I have no idea why they named it that way, but it is your talocrural joint. Sir, you have earned yourself a pass. Thank you. Miss Creel, please talk to me.
I actually looked it up because I was confused what curl meant. It's in relation to the leg, thigh, or any of the crew.
Yeah, in anatomy, it's only in relation to the leg, the front of the leg, but still, yes. I'm sure that's what the word means. Yeah. Very cool. Talocrural joint is your ankle joint. Hey, Miss Korea, what's the name of your elbow joints?
Oh no. Okay, the elbow was with the ulna, humeral ulna.
Yeah. By the way, everybody, I realize the radius is here too. It's not exactly wrong to call it the humeral radial joint, but the strength of your elbow is that you have the strongest connection between your humerus and your ulna. That's where the real elbow action happens. Whereas look down here, what do you suppose you call your wrist joint?
Oh, me? I'm sorry.
Yeah, go ahead, you're right, Miss Korea. I didn't make it clear. But yeah, what do you think you call your wrist joint?
I'm so bad with the hands. That's the radius carpal
Radial carpal joint, yeah. And we're not saying the ulna's not down here, everybody, but look what happens. The radius gets really big down here, so most of your interaction between your carpals is with your radius. So it's called your radial carpal joint, and this is your humeral ulnar joint. Yeah. Well done. Thank you, ma'am. Thank you, thank you, thank you. Miss Rader.
Hello.
Miss Rader, hello to you. I don't like that picture. Okay, Miss Rader. Oh boy. I hope you ate your Wheaties. Miss Rader, what is this diagonal muscle? Let me make sure I'm on the screen here. Hold on. What is this diagonal muscle running across the thigh here?
That's the sartorius.
Yes, you're right, ma'am. What is this muscle right in front, dead in front?
That's the rectus femoris.
She's right. What is this muscle here, ma'am?
Rectus abdominis.
Yes. What is this muscle here?
Pectoralis major.
Yeah. What's this muscle here?
The deltoid.
Yeah. Anterior fibers. You're 100% right. I'm just adding to that. What's this muscle here, this two-headed muscle right here?
Oh, it's a biceps brachii.
Yeah. What is this muscle here that starts on the lateral side and crosses over to the medial side?
The tibialis anterior.
Yes, she's dead on right. Thank you very much, ma'am. That was excellent. Excellent, 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 excellent. Miss Carrillo, yes, talk to me.
I always have a hard time finding it in this position. Where's the gracilis?
You can't
I
see
always
it.
get it in sartorius mixed up.
Well, you can't see it really here because it's covered over by other muscles. It is in your inner thigh, and it would come down like this and insert where the sartorius inserts, because that's the pes anserinus, where three muscles come together. I'll see if we can't get it maybe from a different angle. It is a very superficial muscle. It's just really hard to see in this picture. This might be it going around the back down in there, but it's really, that's probably your gracilis starting there and going all the way down here. But it's really hard to tell from this thing. We need this guy to have be doing jumping jacks or something. Yeah. Where was I? Miss Pugh.
Yeah.
Miss Pugh, well, let's review really quick. What's this diagonal muscle up here going across the thigh?
Sartorius.
Yeah. What's this diagonal muscle here going across the shin? It's in the front of the tibia.
Trying to remember.
It's named front of tibia. Oh, sorry. Try to get back here. Hold on. What's the word for front?
Frontal tibial.
Anterior.
It's been a while.
Anterior.
Oh, tibialis anterior.
Yeah,
anterior,
tibialis anterior or anterior tibialis. Either one. They're good.
Tibialis anterior. Okay.
Cool. Last question. This is hard too. There is a tiny muscle up here that actually inserts into the IT band. Tiny muscle up here. Yeah, tell me.
Like, it's not the pectineus, is it?
Nope, pectineus is an
pectineus
inner thigh muscle here This is a muscle that helps tense up the lot of fascia that you have kind of going down the leg.
Tensor fasciated.
Oh yeah, tensor fascia lata.
Okay.
Itis would be if it was inflamed, but that's good. Thank you, ma'am.
Mm-hmm.
Mr. Overman.
Yes, sir.
Mr. Overman, what muscle is this right here?
It's the rectus abdominis.
Well, you're right, by the way. Then what's this muscle here, this diagonal muscle here?
That would be, well, let's see, is it obliques? So if they're going that direction, that's external obliques.
Yeah, you can't even see the internal obliques because they're truly internal. Hey, what are it's hard to kind of see here, but there's these like finger-like projections. They almost look like the obliques up here, but they're not. What's this muscle here sneaking out from behind?
That is the serratus anterior?
Yes, the saw-like muscle that comes to the front of the body, serratus anterior. Yeah, nicely done. Sir, one more question. There is a muscle that goes kind of from the sternum and the clavicle here up the neck kind of diagonally. It's called the prayer muscle. What is this muscle here?
Sternocleidomastoid.
Sternocleidomastoid. Yes, sir. Well done. Thank you. Thank you, thank you, thank you. Miss Osuna.
Hello.
Hi, Miss Osuna. Hey, Miss Osuna, what muscle is this?
That is your gastrocnemius.
Awesome. Awesome, awesome, awesome. This is a little tricky. I don't know if we can even see all this. Okay. Well, can you tell me what muscles these are back here?
The hamstring muscles?
Yes. Now, I want to help you a little bit. You probably don't need it, but just in case. This muscle back here is actually not a hamstring muscle, and you weren't saying it was, but I just want to point out to everybody, this is actually your...
Adductor?
Yeah, your adductor magnus. It's so big that you can actually hit it from the back. I've actually talked to you guys about this. So you've got two muscles here that are part of your hamstrings. What are these two muscles right here?
The bicep femoris?
I do like that you said that because there's two, but these are two separate muscles.
For the hamstring, it's the semimembranosus and the semitendinosus.
Yes, they're on the medial side. That's how I knew that. The bicep femoris is actually over here, and you can't see the short head because it's underneath the long head. So it's very tricky, but it is there. Very good. Thank you, ma'am. Mr. Manzanares.
Yes.
Mr. Manzanares, what muscle is this?
Gluteus maximus?
Yes, sir, it is. Nice. Good job, sir. One more question, sir, since you seem to be very good at large muscles. What is this ginormous muscle up here? It's the largest muscle of the upper body, probably.
Is it the sagittarius something?
Not serratus anterior. This one is the lateral back muscle. And it's this big V-shaped muscle, both sides here. And it's actually named the lateral back muscle.
The latissimus dorsi?
Yes, good job, sir. Thank you, thank you. Nicely done. All right. Mr. Lee.
Yes, sir.
Mr. Lee, what is this big muscle here? It's this whole thing. It's all this here. It starts with a T. Yeah. Say it.
Yeah.
Trapezius.
Yes.
Nice job, Mr. Lee. Way to knock it out of the park. Thank you, sir. That'll work. Miss Lee.
I'm here.
Oh, good. Okay, you're echoing. That's okay, though. Miss Lee, what is this shoulder muscle here?
Deltoid.
Excellent. Excellent, both of you. I heard that, Mr. Lee, but thank you for helping. That's good. Thank you, ma'am. That's good.
Thank you.
Mr. Godot.
Hello.
Mr. Godot, what is this very attractive three-headed muscle on the back of this person's humerus?
I want to call that a tricep.
I want you to call it a tricep. You and I are in sync. That's fantastic. Thank you, sir. That's perfect. That's enough. We've got to
Thank you.
get on to other stuff here. Just so, let me stop sharing for a second. Yeah, Mr. Jones, talk to me.
Is tricep short for something else? Because we have
Yes.
Yeah.
So
okay.
it's triceps brachii. And,
Gotcha.
and it
That's
means
what I
the
was thinking.
three-headed muscle found in the brachial region, but we will often just call it triceps for several reasons, but also there are no other triceps in your body that I'm aware of.
Yeah, I was just
Whereas
wondering
I
if it
really
was
do
similar
have
to the biceps.
Right, I really do have a biceps femoris and a biceps brachii.
Yes.
I've got one in the leg. So if you're being, in the gym, we all know that people are not talking about their hamstrings. They talk about them as a group in the gym. So if they say biceps, they mean the ones on your arm. But in anatomy, we don't. And if you're with, physical therapists, massage therapists, doctors, it's biceps brachii or biceps femoris. Yeah.
All right.
Thanks,
Thank
sir.
you.
Ms. Osuna, please talk to me.
I apologize in advance because I know I asked this question before.
No.
Can't remember.
That's okay. Yeah.
For the final test, are you just going to show us a picture and we're going to be like, oh, that's the deltoid? Or do we have to say that's the deltoid and it inserts at the deltoid tuberosity and all that?
No. You did ask this before, and I'm not upset you asked it again. It bears explanation. It's kind of confusing. Mostly, it's just a picture. What helps is if you know where certain muscles insert, even if you can't say it, but if you know where they come off of, it's very easy to identify them. Whereas people are like, well, the picture wasn't clear. Well, if you know the deltoid hooks into the acromion process in the spine of the scapula and the lateral 1/3 of the clavicle, even if you couldn't write that down because the test doesn't ask that.
Okay.
But if you know that that's where it comes off of, it's very easy to be like, that's the deltoid, regardless of the quality of the picture kind of thing. So it does help to know your origins and insertions, and there are some questions about actions that require knowing your origin insertions, but there are no questions that literally ask you, that I can think of, that ask you to, name the origins and insertions. Yeah. And it's all multiple choice. So nowhere do you have to type in, the origin insertions, which would be really, really hard. Really hard. Yeah. And are you going to ask us bones? I don't think there are bones on the test, although I've talked about adding them, Miss Avalos, so I might. You guys are unfortunately giving me ideas instead.
Well, all you need to know is there are a system of levers of kinesiology.
That's true.
Need to know.
Actually, that is true. But you need to know their names.
Oh.
But you are right, by the way. The levers and the kinesiology is literally what I want you to know about the skeletal system. You're absolutely right. Hey, Miss Avalos?
Oh, no, yes.
I missed the sound of your voice, and so I'm going to ask you a couple questions. Miss Avalos, wow, I've got to think about this, Miss Avalos, but I think, what did we decide? There are 3, 6, 7. Did we decide there's 7 muscles on the posterior leg? Well, let's break it down. What are the 3 calf muscles, Miss Avalos?
Gastrocnemius, soleus, and plantaris.
Good. If we go beneath those, there's 3 more muscles.
The tibialis anterior, extensor digitorum longus, and the extensor hallucis longus.
But this is on the back of the leg.
Oh, I'm sorry. Tibialis posterior, flexor digitorum longus, and flexor hallucis longus.
Yeah, awesome. And then the only other muscle back there we might argue is the popliteus, which is the key that unlocks the knee. Nicely done, ma'am. Hey, since you're doing so well with the leg, what are the 3 muscles found on the anterior compartment of the leg? And then there's 2 on the lateral side, too. Eventually, I'm going to ask you 5 in total. But what are the 3 muscles? I think you just told us the 3 muscles on the anterior.
I did. So they're the tibialis anterior, extensor hallucis longus, and then the peroneus longus and brevis, or the fibularis longus and brevis.
Yeah, the peroneus longus and brevis, or the fibularis longus and brevis. Beautifully done. Thank you, ma'am. Thank you.
Thank you.
I love that. That's awesome. Okay. So, Miss Dimitra, if a muscle has the word hallucis in it, where does that muscle go to?
The big toe.
That's right, halitosis. That's how I remember it.
Wait. What about that cadaver lab?
What about it?
I didn't see it on our schedule.
Oh, it's coming. I've got approval for it. It's happening. You're going. Yeah, I mean, 99% chance you're going to the cadaver lab. There's always stuff comes up, but 99% chance it's not on your schedule, but it's scheduled. It's coming up. It's towards the end of class. Right
Okay.
towards the end, because that's a good place to put it. It's either, I honestly don't remember everybody, but it's either like the day before clinic and externships or the day after clinic and externships. It's one of those two.
Okay.
Yeah, so that you'll hopefully have your anatomy in there and stuff like that, because we go in there and they do sometimes ask you, what muscle is this? And it's really, it's really good for us to know all that stuff. So anyway, yeah, it's very cool. But yes, we're going at GCU. They've given me tentative approval already and a tentative date and everything. Yeah. Yay! Mr. Richards, please talk to me.
But how does that work with the class? Do we all just go from both?
Yeah.
Campuses,
We all
or-
just, it's kind of nice because we get to spend the day together. We all go and we usually meet there. We go to the cadaver lab, which, believe it or not, doesn't take that long. They give you a tour of the college, which is kind of nice. They don't have to, everybody, but they usually feed us. And it's good eating there. So they usually give you a coupon to one of their restaurants on campus. And they're good. So we kind of make a day of it, and it's kind of nice. Yeah. And then we do, what did you learn that day? And then we try to release you from that campus. So we try to have school at their campus that day in a way, if that makes sense. But it's an outing. It's actually very pleasurable, and it's nice. Hey, Mr. Richards.
Yes, sir.
I have questions for you, too.
Go for it.
Oh, good, good. Mr. Richards, what are the 5 abdominal muscles?
Oh, now you've got me. So the transverse abdominis, the rectus abdominis, the external obliques, internal obliques, and quadratus lumborum.
Good. Mr. Richards, if I turn to my left, what muscles did I use?
If you turn, what do you mean? Like rotate?
Yeah, rotate my spine to my left. What
So
muscle?
the external obliques due to the opposite side, and the internal obliques due to the same side, right?
I don't actually know. I don't memorize it that way. I really don't. I don't know.
So if you're turning to the left, you're using your right external oblique, right?
Yes! Because everybody, if I grabbed onto my belt buckle here and pulled with my right external oblique this angle, I would turn to my left. He's right. And so what else would I use, sir?
Your internal oblique.
On this side too?
On the opposite side. On the
Yes. And remember this. That was 100% perfect, sir. You nailed it. But everybody, what muscle am I representing here? What muscle?
internal.
That's an internal. Yeah. What muscle am I representing here?
External.
Look it. They're parallel. The external oblique on one side matches the internal oblique on the other side, and that's why they pull me that way. Whoa! It's amazing. Don't forget that. It's good stuff. Just so soon that might even be on the test at the end of the year. He said 17 times during the course. Awesome. Very well done. Very, very cool. Okay. So, Mr. Meat Truck reminded us that if a muscle has the word hallucis in it, it's got to go to the big toe. There's actually 7 muscles that go to the big toe. Who can tell me where a muscle goes to if it has the word digity mini-me in it? Mr. Jones.
The pinky toe.
The pinky toe or?
Oh, man.
Don't
There's
overthink.
an or? Oh,
I'll give you $1 million for this answer.
Or the pinky phalange.
Yeah, because hallucis is toe and polycis is thumb, but digity mini-me is your little pinky toe or your pinky. Yeah. And, sir, since I got you on the line, what if a muscle has the word digitorum in it?
Digitorum is like the 3 middle toes.
3 or 4 toes, or
fingers.
Fingers. Toes or fingers as a group. Awesome. Okay. So today, everybody, we're going to be learning about some of the big toe muscles. It's going to come as a shock to you, but each one of these muscles has the word hallucis in it. I know. I'm as surprised as you are. It's very weird. Every last one of them, it's almost like there's a pattern. Let me ask you a question without looking at your book. Mr. Singletary, I've been picking on you today, so let's not stop. Mr. Singletary.
I'm here.
Thank you, sir. Sir, what is the action called when my toes go out like this?
Isn't that dorsiflexion?
I'm not talking about when my foot goes out like that. You're kind of on, but I'm talking about when my toes do that action. Or what's it called when my toes do this action? How do I describe this? What?
It looks like it's just flexion extension.
Good.
Right?
Good. Now just tell me which is which. What am I doing right now?
That's extension.
Yes. Good. So, sir, if I had a muscle that lifted up my big toe, it would be called like extensor hallucis, right? Brevis. We're going to learn about a tiny muscle today. These are muscles, by the way, today that are called brevises. Not all of them, but they live on the foot. They're short. Where would that muscle have to live, sir, to pull out my toes? Would it live on the dorsal side of my foot or the plantar side of my foot?
All right, you got me. I'm trying to.
Let me see. If I can only muscles can only do one thing, sir. What is that?
Extend.
Muscles can extend now? This is amazing.
I'm sorry, what am I saying?
So they can push?
I'm looking at my foot and trying to figure out what your question is, what you're asking me. Contract, sorry.
Muscles can only contract, so they can only shorten, so they can only pull. Right? Where would I have to be to pull my toes into an extension? Would I be on the dorsal side of my foot or the plantar side of my foot?
Dorsal.
Ah! So, an extensor...
So you're saying dorsiflexion, is that what you're getting at?
No.
No.
you're making it harder than it is, sir. You basically answered the question. So if I had an extensor hallucis brevis, everybody, it would probably be hooked to my big toe. Well, I guarantee you it would be hooked to my big toe. And it would probably be on top of my foot because that's where something has to be to lift my toe up.
Right. So that's where dorsal is, on the top of.
Yes.
Like a dorsal shark.
Yes, sir. And if I had a flexor hallucis brevis, where would I probably find that muscle, sir?
That would be on the bottom side of your
Yes. Yeah. And if I had an AB ductor hallucis, where would that muscle be found?
That's gone. Dorsal.
Well, how about on the outside of the foot?
Okay.
And if I had an AD ductor hallucis, where would that be found?
Okay, the AB is going further out. The AD ductor is coming closer in.
So where do I have to be to pull something in? Should I get way over here? Maybe pull it around the world till it comes back? Or should I be in the center of the foot and pull it in?
Be in the center of the foot and pull it in.
Oh, kind of like my hip adductors. I just thought of that, Mr. Singletary. I've got hip adductors and they're kind of in the center of my body, right? I've got toe adductors and they're in the center of my foot and hands. And my abductors are on the outside of stuff. That makes sense because muscles can only do one thing. What was that thing, sir?
Contract.
Yeah. So the reason I did this thing, thank you, Mr. Singletary. The reason we went through this thought process experiment with you was because you guys don't have to memorize what I'm about to show you. When I show you, you're going to be like, duh, right? Instantly. And I want to get you away from just kind of memorizing rules because they don't help you figure out kinesiology. So let me share this screen with you here really quick. Hold on one second. That, okay. share. We're going to learn about, I don't know, 3 or 4 little muscles that'll go really fast because you guys are brilliant now and you understand the language. All right. Okay. So we're going to learn, we're going to strip down some levels of this foot. We're going way down. So let's look at this muscle that goes to the big toe, but attaches kind of to the center of the foot. It looks like a 7. It looks like a 7. And it goes to the big toe, so if it contracted, it would actually pull your big toe back in, which we call an adduction, adduction. And lo and behold, this lucky number 7 muscle is called your adductor hallucis. Now, why is Tapscott making such a big deal about the adductor hallucis? It's not so much that you need to pull your big toe in all day long. It's because this muscle actually adds to the structural integrity of your foot. It helps with your arch support. And I'm not talking about your arch support this way. I'm talking about your arch support this way. This muscle helps pull all the digits together, really. It's called your adductor hallucis, but it should be called your adductor footus, because it really is attached to everything in here and pulls it all together. So it's a structurally extremely important muscle, far beyond what the name suggests. Yeah? That's why it's important. But you don't even have to memorize every last little insertion and all that kind of stuff for this thing, because you just need to remember it's kind of in the center of the foot here and goes to the big toe, and that it's important to the arch support, and it's why we rub the feet so deeply and get into this sucker, and we'll talk about it in a second. There's also a muscle underneath the foot, so if it contracted, it would pull the toe down in a flexion. It is your flexor hallucis brevis. It's called flexor hallucis brevis because you all know there's a flexor hallucis longus that lives on the back of the leg. You already know that. This is a smaller one. By the way, there are 2 sesamoid bones underneath this one. Remember those? The 2 little tiny little baby mouse kneecaps? They're underneath this thing right here. We also have a muscle underneath the little pinky toe, and that's called flexor digiti minimi brevis. Boom, right there. So I just want this stuff to be semi-obvious to you. I don't mean, you know, let me show you. Okay. So let's look at the big toe. On top, we've got a muscle that, believe it or not, goes from your the surface part of your calcaneus. Your heel actually does stick up through here. But anyway, it hooks to your big toe. It is part of the way that you extend your big toe. Now, you don't usually do this alone. Remember, you had an extensor hallucis longus on the shin. But this is your extensor hallucis brevis. They tend to work together. The extensor hallucis longus goes further down the toe. Underneath, you've got a flexor hallucis brevis, right? They run diagonal, by the way, to help keep the toe in. Because your foot, by the way, always wants to smush out. Your foot always wants to smush out. It's under a tremendous amount of pressure. Think about how tiny your feet are and how big you are. It's a tremendous, I don't care if you're the smallest person in class. I don't care if you're 82 pounds sopping wet. That's a lot for a little foot to handle. And it wants to smush out, and so everything's trying to pull it back in so that it has this flex to it and you don't break your bones. So anyway, that's why these muscles run diagonal. But extensor hallucis brevis, found on top of the foot so it can extend. It's called brevis because you have a longus. It's called hallucis because it goes to the big toe. Flexor hallucis brevis, you have a long one in, in the back of your leg, so this is the short one, brevis. It's going to the big toe. It's called hallucis. It's underneath, so it pulls the toe down in a flexion, flexor hallucis brevis. I hope I am boring you and sound like a broken record. Good. All right. Then there's the adductor hallucis. Yes. Why is the adductor hallucis important beyond just adducting the hallucis? Why? I made a big deal out of it here 2 minutes ago. Miss Rader, please.
It helps support the arch of your foot.
Yes. And I'm talking about the lateral arch. Your foot has this curve this way, but it actually has a curve underneath the other way. And it helps support that arch, yes. By the way, it probably supports both arches. You make a really good point. But anyway, yes, it is an arch support muscle, even though we don't necessarily think about it. Look how thick it is, and look how many toes it's hooked to, right? Yes, it's going to the big toe, right? But it has origins on the base of the 2nd through the 4th metatarsals. Yep. And the plantar ligament that runs through the 3rd through the 4th toes. So really, a very simple way of putting that is it's hooked to the both ends of most of your metatarsals, right? And it pulls all those together with the big toe. So really, this thing is a metatarsal puller together. That's what it does. And then, just for good measure, we threw the flexor digiti minimi brevis in there. And the reason I'm making such a big deal about how these things go together is one thing I want you to remember. Foot complexity. Foot complexity is extremely important. It's all about feet. All about feet. The foundation of your body. You know, I've never once in my life seen a well-built building that was built on a poor foundation. It is impossible. It will eventually fall. It will always have problems. If you've ever gone into a house, and I have, you see cracks on the ceiling, look at the foundation. It's almost always a foundation problem, unless the roof is leaking or something. So that's one of the reasons we make a big deal out of feet, and all these muscles. But I also want to make a big deal out of this stuff because I don't expect you to remember every last muscle. But 10 years from now, when some smartass walks into your massage room and tries to trip you up on anatomy and says, blah, 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 hallucis brevis, you'll go big toe foot. And when they say flexor, you'll go big toe bottom foot. You won't remember exactly that it went to which metatarsals, all that stuff, but you'll be able to put your hand in that region and they'll be like, oh, this person knows their anatomy. Why is that important? Well, it's important. Let me stop sharing here. It's important because when that first interaction does not go well, they assume you don't know what you're doing. And unfortunately, part of our job is truly having skill, but the other part of our job is acting like we have skill, right? It's proving to somebody they have skill, right? And people really buy into that. So you really, really, really want to be able to speak to your anatomy when they come in the room. You just don't want to be tripped up. It doesn't have to be dead on accurate, but when somebody comes in and says, blah, 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 polycis, I immediately grab their hand and their forearm because I know we're talking a thumb muscle. And they're instantly like, oh, this guy really knows his stuff. Nobody knows that stuff. I don't know every last one but I know roughly where they are. And I know where to start working. So that's why it's super duper important. Okay, everybody,